Good morning, and welcome to the last week of February. My name is Mitesh Parikh, and I'm the Chief Operating Officer for Providence Medical Group. This is my first opportunity to speak with you, so I'm really excited to quickly introduce myself, talk about Providence Medical Group, and some of our priorities so you feel better acquainted with us in 2019. So briefly about myself, again, I have been the Chief Operating Officer for PMG for the last year, and previous to that had been our Vice President for Service Lines and Business Development for 5 years. So I feel very, very much a person of Providence and very, very fortunate to be here. Previous to that, I'd been at Legacy Health in Portland and Seattle Children's. So up and down the I-5 corridor a fair amount over the last 10 to 15 years, but very, very thrilled to be part of this community in the Northwest service area. I'm excited to announce that I will have a new Chief Medical Officer joining Providence Medical Group in 2 weeks. Dr. Stephen Campbell will be wrapping up an engagement in California and joining us. He was previously with the Everett Clinic for several years, but perhaps more importantly, had spent most of his career at the Mayo Clinic, so is well-versed in quality, patient safety, and patient engagement. I'm very excited to get him to Everett as well as we continue to build on the great PMG experience that we have in this county. So I do want to take a moment and share a little bit with you over these next couple of minutes. I'm going to tell you a little bit about Providence Medical Group. It has grown tremendously over the last 5 years and want to reacquaint you with who we are. And I'm going to talk a little bit about our priorities and areas of focus for 2019. So Providence Medical Group. We span north up to Marysville, out east with our big box in Monroe, and down south to Mill Creek with some new presence in Edmonds as well. So we're pretty well distributed across Snohomish County to take care of patients. We have roughly 300 providers, and last year we took care of 570,000 visits. PMG is actually responsible for about 150,000 patients, which means about 1 in every 6 people that lives in Snohomish County actually get their care from us, so pretty significant. That's PMG big picture. We continue to grow, and we're focused on adding services and programs and providers that take care of our patients even better. That's a key priority for us. So I'm going to start there and share a little bit about that. From a national perspective, mental health is a huge issue. Mental health and substance abuse, to be particular. PMG Primary Care continues to make this an area of focus. We have focused and invested on care management and social work services in all of our primary care clinics at this point. And in 2019, we're continuing to expand that into our specialties. We're actually in the process of evaluating a behavioral health urgent care, which would sit side by side with our current ED and PRMC. This is a huge national issue, and PMG is very focused on this at the local level as well. Another area of focus for us is around obesity and nutrition, recognizing again that this is a huge national issue. At the local level, PMG is starting to focus and invest in partnerships with dietitians across our key clinics, and we're also partnering with a group, HMR, which focuses on weight management, telephonic counseling, on-site clinical care. This is a system initiative, but we are very focused in advancing this at the local level as well. So I think as a first priority, we are very focused on national issues and making sure we're taking care of our patients in Snohomish County as they're affected as well. Beyond that, we're focused every year on continuing to add new services to help better take care of our patients. This year, I'm really excited. We are looking to add physical therapy services through PMG, a huge gap in the past, and will be a huge addition to the care that we provide for our patients. We're focused on advancing the level of stroke care with our neurologists and neurohospitalists this year, so we'll have new providers with new skills that come on board later this year or early next year. Additionally, we're adding new sports medicine services at Mill Creek to take care of our weekend warriors and all those athletic activities that simply don't need to end up in the urgent care or ED. So every year, we are continuing to grow and adapt and add services that better take care of our patients in the PMG environment. The other thing that I think is really important to talk about as another area of priority is how we take care of our patients. And we're really dedicated to taking care of our patients when they need us and where they need us. And that means differentiating ourselves in some ways. I'm very excited. We're going to be opening our new Clearview Clinic in April with primary care. We had a location in that area previously that wasn't operational. We've just recognized that as a huge growing need in the community, and so we'll be reopening Clearview in a couple of months, so very excited by that. We continue to grow and advance our telemedicine and virtual services. And much of this is in partnership with our Express Cares, which I know many of you have used. We're continuing to move beyond bricks and mortar and working with making sure our patients get care in the places and in the ways that they need them. Some of this also involves simply being available for our patients when they need us later. You may have heard that as of January, all of our primary care clinics, to some degree, will be open till 7 o'clock based on their size and location. So we're trying to take a better job of our patients when they need us, where they need us, whether it's geography, how they get to us, or simply in terms of being available to them. I think overall, big picture, though, we're continuing to make investments and to add to our primary care base and our specialty so that we're able to better take care of our patients. Ultimately, we're committed to a fabulous patient experience for when they need us, where they need us, and how they need us. That really is a key area of focus for Providence Medical Group as we move through the next decade. So hopefully you feel like you have a little bit of a better understanding of Providence Medical Group and who we are, where we are, and what we're trying to accomplish. I look forward to being able to have this dialogue with you in the future, as will Dr. Campbell. I do want to leave you with just a couple of quick notes here. We've recognized that across all our campuses, there's been an increase in smoking, particularly around main doorways into PRMCE, outside of the ED, at clinic entrances. We are a smoke-free campus and simply want to remind people that in the best health of our patients, we do not smoke on the premises of our campuses. Also want to remind you that the next challenge around Virgin Pulse is out, and would encourage you to log in and check in on that. And there are a number of requirements around safety, certification, and reporting that open up on March 4th. So I would encourage you to check out the next version of our newsletter and to be aware of those requirements as well. I'm very excited to have had this opportunity to talk with you all virtually. Please feel free to stop me if you have PMG questions, and look forward to the opportunity to engage with you in the future. Thank you.